Mpox, formerly known as monkeypox, is a viral zoonotic disease. This means it originates in animals and can spread to humans. While it was initially discovered in monkeys, rodents are now considered the primary reservoir. The virus can transmit through close contact with infected animals, such as bites or scratches, or through contact with their bodily fluids. Human-to-human transmission occurs primarily through close physical contact. This includes direct contact with skin lesions, bodily fluids, or respiratory droplets of an infected person. Contact with contaminated materials, such as bedding or clothing, can also spread the virus. It's important to note that casual contact, like passing someone in the street, poses a very low risk of transmission. Understanding the modes of transmission is crucial for implementing effective preventive measures. By limiting close contact with infected individuals and practicing good hygiene, we can significantly reduce the spread of Mpox. Early detection and prompt isolation of cases are also vital for controlling outbreaks. The virus belongs to the orthopox virus genus, which also includes the variola virus, causing smallpox, and the vaccinia virus, used in the smallpox vaccine. Although Mpox shares some similarities with smallpox, it generally presents with milder symptoms and a lower mortality rate. However, it's important to remain vigilant and take necessary precautions to prevent its spread. Continued research and public awareness campaigns are essential for managing this evolving health concern.
Mpox typically begins with flu-like symptoms, including fever, headache, muscle aches, back pain, and swollen lymph nodes. This initial phase can last for several days before the characteristic rash appears. The rash often starts on the face and then spreads to other parts of the body, including the palms of the hands and soles of the feet. The rash evolves through several stages, starting as flat, red bumps that then become raised and filled with clear fluid. These blisters eventually become pustules, filled with yellowish fluid, before finally crusting over and falling off. The entire process can take several weeks. It's important to note that the severity of symptoms can vary from person to person. While most individuals with Mpox experience a relatively mild illness and recover fully, severe complications can occur in some cases, particularly in young children, pregnant women, and individuals with weakened immune systems. These complications can include secondary bacterial infections, pneumonia, and, in rare cases, encephalitis, which is inflammation of the brain. Early diagnosis and prompt medical attention are crucial for managing Mpox and preventing serious complications. If you experience any symptoms suggestive of Mpox, it is essential to seek medical advice immediately. Healthcare professionals can provide appropriate diagnosis and treatment, as well as guidance on isolation and preventive measures. Staying informed about the signs and symptoms of Mpox is crucial for protecting yourself and others.
Isolation is paramount upon suspected or confirmed Mpox infection. Isolate yourself immediately to prevent further spread. Stay in a separate room, away from other household members, and avoid sharing personal items like bedding, towels, and utensils. Contact your healthcare provider promptly for guidance and testing. Public awareness plays a crucial role in containing outbreaks. Educate yourself and others about Mpox transmission, symptoms, and preventive measures. Share accurate information from reliable sources like the World Health Organization and local health authorities to dispel misinformation and reduce stigma. Use appropriate personal protective equipment, or PPE, when caring for someone with Mpox. This includes gloves, a gown, and a well-fitting mask, especially when handling lesions or bodily fluids. Dispose of contaminated materials safely according to healthcare guidelines. Maintain meticulous hygiene. Wash your hands frequently with soap and water or use an alcohol-based hand sanitizer, especially after contact with potentially contaminated surfaces or individuals. Regularly disinfect frequently touched surfaces in your home.
Section 4. Avoiding pitfalls. Important don'ts in Mpox. Response. Avoid panic. While Mpox is a serious public health concern, it's important to remain calm and informed. Rely on credible sources for information and follow recommended guidelines. Panic can lead to the spread of misinformation and hinder effective control efforts. Don't delay reporting. If you experience symptoms suggestive of Mpox, seek immediate medical attention. Early diagnosis and treatment are crucial for managing the illness and preventing complications. Prompt reporting also helps health authorities track the spread of the virus and implement necessary control measures. Avoid overcrowding healthcare facilities unless absolutely necessary. This helps protect both patients and healthcare workers from potential exposure to the virus. Utilize telehealth services whenever possible for routine medical consultations. Don't ignore mild symptoms. Even if your symptoms seem mild, it's essential to consult a healthcare professional. Mild cases can still be contagious, and early intervention can prevent the progression of the illness and reduce the risk of transmission.
Section 5. Protecting yourself and others. Preventive measures for everyone. Practice good hand hygiene. Wash your hands frequently with soap and water for at least 20 seconds, especially after using the restroom, before eating, and after contact with potentially contaminated surfaces. Use an alcohol-based hand sanitizer when soap and water are unavailable. Avoid close contact with individuals who have suspected or confirmed Mpox. This includes direct contact with skin lesions, bodily fluids, and respiratory droplets. Do not share personal items, such as bedding, towels, and clothing, with infected individuals. Clean and disinfect frequently touched surfaces regularly. Use a household disinfectant appropriate for killing viruses. Pay particular attention to surfaces like doorknobs, light switches, countertops, and electronic devices. If you are caring for someone with Mpox, wear appropriate personal protective equipment, or PPE. This includes gloves, a gown, and a face mask. Dispose of contaminated materials safely according to healthcare guidelines.
Section 6. Caring for loved ones. Guidance for families and caregivers. Provide supportive care to infected family members. Ensure they have access to fluids, nutritious meals, and pain relievers to manage symptoms. Monitor their condition closely and seek medical attention if their symptoms worsen or if they develop complications. Isolate the infected individual within the household. Designate a separate room and bathroom for their use, if possible. Minimize close contact and avoid sharing personal items. Wear appropriate PPE when providing care. Educate other family members about Mpox and its transmission. Explain the importance of preventive measures, such as hand hygiene and avoiding close contact. Encourage open communication and address any concerns they may have. Maintain a clean and disinfected environment. Regularly clean and disinfect frequently touched surfaces in the home, especially in the area where the infected individual is isolated. Dispose of contaminated materials safely. Follow healthcare guidelines for cleaning and disinfection.